Bismillah ar-Rahman ar-Rahim. We will continue anesthesia review. The first point, we are talking about airway fire in laser surgery. The most effective method to avoid airway fire in laser surgery is tubeless techniques that include spontaneous ventilation, apneic oxygenation, or jet ventilation. Second point, we are talking about pheochromocytoma. We should use alpha blockers before giving beta blockers in pheochromocytoma. The drug of choice of alpha blocker is phenoxybenzamine. Phenoxybenzamine is given before beta blockers in pheochromocytoma. How to adjust dose of phenoxybenzamine? It will not be by catecholamine level in urine. This is a mistake. You are not adjusting phenoxybenzamine level, phenoxybenzamine dose by the level of catecholamine in urine, but you are adjusting it by symptoms of catecholamine excess shouldn't be exist, and side effects of phenoxybenzamine like postural hypotension, tachycardia, or stuffy nose. We're talking now about Poon-Seaman syndrome. Poon-Seaman syndrome, that's new, is not due to hypersensitivity to methyl methacrylate, but due to increased intramedullary pressure that cause embolization of fat particles and debris to medullary venous plexus, and this is causing tachycardia, hypotension, hypoxia, and right bundle branch block due to pulmonary hypertension. So, in Poon-Seaman syndrome, it's not due to hypersensitivity, but it's increased intramedullary pressure. When we are using tourniquet in the upper limb, ulnar nerve is not affected by upper limb tourniquet. The most common nerve injured after using tourniquet in upper limb is radial nerve. What is in general complications of tourniquet? During inflation, there is microvascular thrombosis, there is increased preload and afterload, there is radial nerve or in general nerve injuries. During deflation, there is fibrinolysis, there is decrease in core temperature and hypothermia, and also increased BaCO2 that increase cerebral blood flow and increase intracranial pressure. How is cold induce hypertension? Cold induce the hypertension when hypothermia, that is release of catecholamines and increase blood pressure and causing arrhythmia. Hypothermia causing peripheral vasoconstriction, that cause metabolic acidosis and coagulopathy and platelet dysfunction and arrhythmia. When there is open globe surgery, we have to avoid regional anesthesia. It's not applicable. When there is full stomach patient, there is no use of LMA, laryngeal mask airway. Succinylcholine can increase intraocular pressure from 6 to 12 millimeter mercury, and this will be temporary for 7 to 10 minutes. And as you know, cuff strain can increase intraocular pressure up to 40 millimeter mercury. So prevention of cough and straining is more important than avoidance of sacs, although you have to avoid sacs. If you have to use sacs, you can use non-depolarizing muscle relaxant dose before use of succinylcholine. If no risk of difficult intubation, use non-depolarizing muscle relaxant from the start. Thank you.